Hello, my name is Renee, and I am a transgender patient of Dr. Perlman at the University of Iowa Hospital and Clinics. I recently underwent an orchiectomy with Dr. Perlman back in March 2021, and I just wanted to share with you all my experience with that, kind of my steps throughout the process, so that you know what to expect and kind of how things go. So starting from the beginning, we'll kind of go over the consultation process. I had my consultation with Dr. Perlman back in 2020, and I went in for a consultation for the full reassignment surgery down below. As my kind of situation changed, I felt that starting with the orchiectomy and then going back to a later time for the rest of the surgery is what made sense for my situation, and so that's what I did. Just something to remember, because I didn't fully prepare myself for this. Going into a consultation for any kind of type of lower surgery can be very triggering. All that dysphoria that we have with what's going on down there. Even being around great hospital staff, a fantastic doctor, it was still very emotional and scary for me. So don't feel bad if you feel the same way, but be aware of it and just kind of set your expectations accordingly. When I first met Dr. Perlman, when she came into the office, very friendly, she asked me how I refer to my anatomy, and I told her, and then throughout the entire consultation, she matched my vocabulary, and it made me feel very comfortable with the way I kind of communicated with her, because there didn't seem to be kind of like scientific talk or medical talk. It was on my level, and that was very nice. So a big part of any surgery is insurance, what they're going to cover, and how that looks. So I actually called my insurance before I even went for a consultation, just to find out, make sure that they covered the procedures I was looking to get, and I wanted to know what my responsibilities were for payment on that. So I would recommend you do that as well. Find out what they cover, and that will help you feel a lot more prepared kind of going into this. If you don't have insurance, I do know that Dr. Perlman kind of has an option for that as well, in order to kind of help some people that might not have coverage. So don't let that stop you. Just make sure that you talk to Dr. Perlman and let her know about that. The university financial counseling department also allows you to kind of apply for financial aid on that. Make sure you get a hold of them, talk to the billing department, and get an application for that and apply for that as well. One thing that was a big help for me when it came to the insurance and kind of navigating through all that was a position at the hospital is called the Transgender Patient Navigator, and her name is Sheila, and she was actually able to answer a lot of my questions for me and kind of reach out to different departments in the hospital on my behalf to kind of answer those questions, so I wasn't just calling everyone that I could think of. And she has experience working with other transgender patients, so she was able to use that to kind of help me through the process. So definitely use the hospital's resources. Everyone is very friendly, everyone's very helpful, everyone in the urology department to the billing department. Use the LGBTQ clinic as a resource, and they will definitely help you out. So one of the other steps of planning this surgery is related to the anesthesia. I actually had talked with Dr. Perlman and let her know that I wanted to be conscious during the surgery, that I didn't want the general anesthesia. She was okay with this. She actually gave me several different options to choose from the going to sleep throughout the whole process to being mildly sedated to just having a local anesthetic. So I went with what's called twilight anesthesia. So I was conscious throughout it. I was able to ask questions, and it was a really great experience. I was very happy with that decision, and I was very happy that I kind of got to choose and plan the surgery for what worked best with me and kind of what I wanted to experience. Once your surgery is planned, you will receive many reminders about what you can eat and drink prior to your surgery date. Several reminders, so you will not forget. I found that it was best to set alarms on my phone for kind of when I needed to stop eating, when I needed to stop drinking. So I'm just going to kind of run down kind of what those diet restrictions are. They also have restrictions for what you can and can't wear to the day of surgery. So in regards to the dietary restrictions, you are supposed to stop eating 8 hours prior to your surgery. They want you to stop drinking non-clear liquids 6 hours before, and then you have to stop drinking clear liquids 2 hours before. So again, this is where setting alarms for yourself is going to be very helpful in this process. When it comes to the apparel restrictions, you will need to take off any kind of nail polish on your fingers and toes. Sometimes during surgeries there can be circulation issues, and they're able to kind of monitor your toes and fingers to see what, make sure your nails stay clear and detect any kind of issues with blood flow on that. You will have to remove all of your jewelry. That includes earrings, necklaces, bracelets. Make it easy on yourself. Don't even bring them with you to your surgery day unless you feel like you're going to want to kind of spruce yourself up afterward. Do not wear contacts to your surgery. They do prefer that you wear your glasses so that you can take those off. If something were to happen, they don't want you to have any kind of foreign objects in your eyes. They give you the paper on what you can and can't do, the full list of restrictions. There's links to it. They ask you if you have any questions regarding that. So these are just a few things to kind of prepare for and be aware of, but definitely follow their guidelines specifically. When you have kind of started your whole surgery day, the nurses will ask you if you would adhere to these guidelines. So be honest with them and just make it easy on everybody, and make sure that you have everything removed and that you have followed the dietary restrictions. So what do you wear to surgery? Well, once you get there, you're going to be taking everything off and getting into a gown, so you don't have to be fancy. Again, I found it was easy to just go simple, make it easier on myself when it came to undressing and getting dressed back up after surgery. So I just wore a t-shirt, some sweatpants, and some sneakers. It worked. I can't say I was very comfortable in it because I'm never really comfortable in sweatpants. I'm glad that I didn't wear jeans or shorts. So I feel like I did kind of go the safe route with that. So I would just recommend wearing a top, bra, pants that you feel comfortable in, but it's easy to take them off and easy to put them back on. It doesn't have a bunch of zippers or buttons. For shoes, like I said, I wore sneakers. They were easy to slip on, take off. Having any kind of flats or slip-on shoes would have also been great. Crocs if you're into that kind of stuff. I did find that the underwear I wore could have been a little bit snugger. After surgery, it's kind of best that everything's held close up to your body. It restricts movement from that. It restricts any kind of chafing or irritation to the site of surgery. So if I was going to change anything, it would have been wearing a kind of a tighter pair of underwear for that. I would recommend wearing a pair of underwear that you don't mind throwing away if you have to. I didn't necessarily have an issue with that, but be safe if you don't want to ruin what you're kind of wearing. So before going into this, I did a lot of research online, read a lot of different experiences from a lot of different people on what to expect for recovery time. I will say that almost everything I read did not apply to me in this case. I was kind of under the impression that it would just be kind of like a weekend thing and you'd be feeling great by Monday. That is not exactly what happened for me. So I did have my surgery on a Friday morning and I was back to work the following Monday, but I definitely overdid it that Monday and kind of had some issues arise in my recovery because of that. So I'm going to make a video just kind of detailing that a little bit more, but I will say expect this recovery time to be like 1 to 2 weeks to be safe. I'm not saying that you can't do anything, but just know that you will be at a kind of a reduced level of operating. During my recovery, there were several different concerns that I had, different experiences that I couldn't really find much information on online. There is an on-call urologist in the evenings, and I ended up calling and speaking with both nurses and the on-call urologist several different times throughout the recovery time. I was also able to reach out to Dr. Perlman through my chart. So even though I kind of had a different recovery from what I expected, I did feel like there was resources for me to reach out to at the hospital, and it was able to help. I lastly kind of want to touch on potential triggers that you might experience during this process of getting an orchiectomy. I will say that most of my fears were for naught, but there was a couple of them that I kind of experienced that I wanted to make sure that I made you all aware of. So the first one was you have to wear an ID band on your wrist when you go and get a surgery done. On that ID band, it will have your current legal sex, the initial for it, and there's a little picture of a stick man on there. That was extremely kind of triggering to me. However, I was in a pretty good headspace going into this surgery, so I tried not to let it bother me that much. I flipped my bracelet upside down and didn't look at it for the entire rest of the day. But I actually ended up talking with nurses from the surgery department, urology department. I spoke with doctors from anesthesia, spoke with Dr. Perlman about it. I spoke with Dr. Knisley at the LGBTQ clinic, and they were all very understanding, and Dr. Knisley is actually kind of reaching out to the leadership at the hospital to see if this is something that can be changed. Right now though, this is kind of the protocol that the university follows in regards to any kind of legal or insurance matters. Personally, I find it kind of unnecessary, and it was very triggering for me, so be aware that that is going to happen unless something changes between now and then. The next thing that I kind of experienced and had kind of a fear of was any kind of misgendering that would happen. Because an orchiectomy is more often performed on cis men than on trans women, there was a fear of being misgendered. This actually only happened once, and it wasn't even directly at me. It was two different nurses out in the hallway talking with my door closed. It was just cracked open enough that I could kind of hear her. One of the nurses misgendered me, but then immediately corrected herself, even though she didn't know I could hear her. And that actually kind of made things a lot better for me, because it showed me that she cared enough and was very genuinely aware of that she would correct herself even when I wasn't around. So it wasn't all that bad of a trigger for me. That was just kind of a mistake that, you know, anyone could make when they're dealing with a surgery that maybe is veered more towards cis men than trans women. So again, I felt like, you know, I felt very comfortable talking with the staff and the doctors about any of these kinds of issues, and I definitely felt like they addressed it, made me feel good about kind of them following up on it, so I definitely appreciated that. So kind of wrapping this video up, just remember this is not a fast or easy process. It takes a lot of time and planning. Use the resources that the hospital has to offer. Talk with Dr. Perlman about all of your options. Be honest about your concerns. Remember that you can do it. There's resources out there that you can use that the hospital offers. The LGBTQ clinic is a great source of resources, so talk with them. Don't feel bad about asking questions that you may feel are kind of goofy or whatever. Use them and make sure you feel better about this. And something that's exciting is once you have an orchiectomy, you can actually get your letter for your gender change. And then you can start the process of getting that all done on your legal documents. So I will kind of go into more details on that in a later video, but that's something exciting to remember once you get an orchiectomy done. Thank you, and I look forward to sharing some more of my experience.